This medication, Incassia, is used to prevent pregnancy and is often referred to as the mini pill because it does not contain any estrogen. It contains norethindrone, which is a hormone that prevents pregnancy. It is more effective than certain other methods of birth control, such as condoms, cervical cap, and diaphragm, but it is less effective than combination hormone birth control because it does not consistently prevent ovulation. It is usually used by women who cannot take estrogen. To reduce the risk of pregnancy, it is very important to take this medication exactly as prescribed. It is important to note that using this medication does not protect you or your partner against sexually transmitted diseases, such as HIV, gonorrhea, and chlamydia. The daily dosage and optimal timing for taking this medication should be discussed with your healthcare provider. Before you start taking Incassia, it's important to read the patient information leaflet provided by your pharmacist. This leaflet contains crucial information on when to take your pills and what to do if you miss a dose. If you have any questions, don't hesitate to ask your doctor or pharmacist. You should take this medication by mouth as directed by your doctor, usually once daily. It's best to pick a time of day that is easy for you to remember, and take your pill at the same time each day. Taking this medication after your evening meal or at bedtime may help if you have stomach upset or nausea with the medication. It is recommended to begin taking this medication on the first day of your menstrual period. If you start taking it on any other day, use an additional form of non-hormonal birth control for the first 48 hours to prevent pregnancy until the medication has enough time to work. After taking the last tablet in a pack, start a new pack the next day. There is no break between packs, and you do not take any reminder tablets. Your periods may be irregular, or heavier/lighter than usual, and you may experience vaginal bleeding, spotting, between periods. Do not stop taking your pills if this happens. Pregnancy is more likely if you miss pills, start a new pack late, or take your pill at a different time of the day than usual. If you miss a pill, or take it 3 or more hours later than usual, or have diarrhea, or vomit soon after taking a pill, use a backup method of birth control every time you have sex for the next 48 hours. If you have been using other forms of hormonal birth control, it's important to consult your doctor or pharmacist about how to switch to Incassia. If any information is unclear, consult the patient information leaflet or your doctor or pharmacist. If you experience nausea, vomiting, headache, bloating, breast tenderness, or weight gain, or if you notice vaginal bleeding between periods or missed/irregular periods, let your doctor or pharmacist know. If you miss 2 periods in a row or 1 period if you haven't taken the pill properly, contact your doctor for a pregnancy test. Remember, your doctor has prescribed this medication because they believe the benefits outweigh the potential side effects. Many people using this medication do not experience serious side effects. However, if you notice lumps in the breast, changes in mood such as new or worsening depression, severe stomach or abdominal pain, unusual changes in vaginal bleeding, dark urine, or yellowing of the eyes or skin, contact your doctor immediately. While it's rare, seek medical help right away if you experience symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects not listed, contact your doctor or pharmacist. In the U.S., call your doctor for medical advice about side effects. You may report side effects to FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, call your doctor for medical advice about side effects. You may report side effects to Health Canada at 1-866-234-2345. Before starting Incassia, it's important to let your doctor or pharmacist know if you have any allergies to norethindrone or other progestins. This medication may also contain inactive ingredients that could cause allergic reactions, so be sure to discuss this with your pharmacist. It's also important to inform your doctor or pharmacist about your medical history, particularly if you have had abnormal breast exams, endometrial or breast cancer, low levels of good cholesterol, depression, diabetes, severe headaches or migraines, jaundice during pregnancy, liver disease, or unexplained vaginal bleeding. If you are planning to have surgery, make sure to let your doctor or dentist know about all the medications and products you are using, including prescription drugs, non-prescription drugs, and herbal products. It's worth noting that Incassia may cause dark areas on your face and skin, which may worsen with sunlight. It's best to limit your time in the sun, avoid tanning booths and sun lamps, and use sunscreen and protective clothing when outdoors. It's important to avoid using Incassia during pregnancy, and if you think you may be pregnant, it's crucial to inform your doctor right away. Additionally, this medication can pass into breast milk, so consulting your doctor before breastfeeding is recommended. It's important to be aware of potential drug interactions that could affect how Incassia works in your body. Some medications can decrease the effectiveness of hormonal birth control, leading to a higher risk of pregnancy. It's important to discuss any new medications with your doctor and consider using additional reliable birth control methods. You should also let your doctor know if you experience any new spotting or breakthrough bleeding, as these could be signs that the birth control is not working effectively. Additionally, Incassia may interfere with certain lab tests, potentially causing false results. Make sure to inform all healthcare providers that you are taking this medication to ensure accurate test results. If someone has taken too much Incassia and is experiencing severe symptoms like passing out or difficulty breathing, it is important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. Symptoms of overdose may include severe nausea, vomiting, and sudden or unusual vaginal bleeding. Now, let's talk about the uses of Incassia. Incassia is a medication used to prevent pregnancy. It is a birth control pill that contains two hormones, progestin and estrogen. It works by preventing the release of an egg during the menstrual cycle, as well as making the vaginal fluid thicker to help prevent sperm from reaching an egg. It is important to take Incassia at the same time every day to ensure its effectiveness. The daily dosage is 1 pill a day, and it is best to take it at the same time each day. It can be taken with or without food, but it is important to be consistent with the timing. And as always, if you have any concerns about your medication, consult with your healthcare provider. It's important not to share Incassia with others. While taking Incassia, it's important to have regular physical exams and medical tests, such as blood pressure checks, breast exams, pelvic exams, and pap smears. Make sure to follow your doctor's instructions for examining your breasts and report any lumps right away. It's essential to keep all medical and lab appointments. If you have any concerns or need more details, consult your doctor. If you miss a dose of Incassia, refer to the product package for instructions on what to do. It's important to use a backup form of birth control, such as condoms or spermicide, to prevent pregnancy. If you have any questions, be sure to ask your doctor or pharmacist. If you find that you frequently forget to take your pills as directed, it's a good idea to talk to your doctor about possibly switching to a different form of birth control. This will help ensure that you are effectively preventing pregnancy. Make sure to store Incassia at room temperature, away from light and moisture. It's important to keep it out of the bathroom and away from children and pets. When it comes to disposing of Incassia, don't flush it down the toilet or pour it into the drain unless specifically instructed. Make sure to properly discard the product when it's expired or no longer needed, and you can consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.